As a board-certified emergency physician, many people ask me when should they go to the emergency room. Many times the answer is simple and straightforward. If you think you're having a heart attack, if you're having a stroke, your child just took a whole bottle of pills, you need to go to the emergency department. Other times it's not so straightforward. What if you have a fever and a cough? What if you slipped and sprained your ankle? Is it broken? Do you need to have it checked? Could it wait till the morning? Sometimes the answers are not clear. In many cases, there are additional resources that you can use. There are nursing call centers, and many insurances have helpful information on when you should go to the emergency department. If you're in doubt, it's best to be seen by an emergency physician. Many emergency room visits happen after regular hours, according to the Centers for Disease Control. This is because people do not always have access to their physician's advice. The best way to decide if you need to go to an emergency room is if you have a recent onset and severe condition that may be medically or behaviorally related. For example, if you develop shortness of breath, and this is a new thing for you, you need to be seen in an emergency department. If you have a family member who is feeling suicidal or homicidal or at risk to themselves or others, they also need to be seen in an emergency department. If you have an issue which you think may cause serious bodily harm or damage to your organs, that is also a situation that needs to be seen in the emergency department. People presenting with chest pain, sudden weakness of the arms or legs, difficulty speaking, and other problems like that need to be immediately seen in an emergency department because those could be signs of strokes and heart attacks. Some of the more common problems that we see in the emergency department revolve around complaints such as shortness of breath, chest pain, abdominal pain, and accidents and injuries. If you have a serious condition, you should not drive yourself to the emergency department. You should call an ambulance. You need to know when to call 911. Urgent care and retail clinics cannot handle all emergencies. They can handle sore throats and colds, but are not equipped to handle true emergencies. If you present to one of these locations with an emergency, the staff at that location will assist in getting you to the closest emergency department. Freestanding emergency departments can provide the same level of care as a hospital-based emergency department. The emergency room can save your life when you have a medical crisis. We are always there when you need us.